what guidance do you have on people who are inclined to avoid confronting their situations?
Well, the first guidance I have is to ask yourself, are you avoiding difficult challenges in your life, uncomfortable challenges, and would you be better off facing it in the long term, even though it might be very, very uncomfortable in the short term? So that would be the first step. And then if you decide you're better off facing these challenges, then use REBT, look for your musts, look for your shoulds. It must be easy, it must be comfortable, it must be it must happen quickly, or I must do it perfectly in facing these challenges, or I must have immediate success. So people are very good at making up an infinite number of musts and shoulds about this situation, which tends to lead them to avoid facing challenges. You said something about readiness to confront themselves, and I think that there's a lot of misunderstanding about readiness, which a lot of therapists have. So some therapists will use various preliminary approaches to helping people because they're not ready. And one of the things that's popular these days is called motivational interviewing, where they claim there are 4 steps to change, and the first one has to do with readiness, I believe, and diagnosing whether the person's ready. But I don't think that's that useful. First of all, you could ask someone if they're ready. That'll give you a good idea. And then if someone does make changes, and you could say, well, that proves they're ready. And if someone doesn't make changes, that proves they weren't ready, but it's kind of circular, and it doesn't really give you a way to diagnose things in the first place, other than just asking them and then presenting them with an approach and seeing if they want to try it, experiment with it, do some trial and error testing. And that's the main way to find out readiness without wasting time on preliminaries. So rather than asking if I'm ready to confront myself, I think the better thing to do is confront myself, see if this improves my life, see if I do melt into a puddle because I'm facing discomfort. And often people predict in advance the discomfort will be greater, or the anxiety will be greater than what they actually experience. So there's no test like getting involved. The proof of the pudding is in the eating. So the proof of the benefits are in doing it, trying it, and see if it benefits you, see if it's as bad as you think.